The origin of the human immunodeficiency virus has been a subject of scientific research and debate since the virus was identified in the 1980s. There is now a wealth of evidence on how, when, and where HIV first began to cause illness in humans. HIV, or human immune virus, is a virus that targets cells in the immune system. Over time, the immune system begins to fail, which is called immunodeficiency, and this increases the risk of infections and tumors that a healthy immune system would usually be able to fend off. These complications are referred to as AIDS, or acquired immune deficiency syndrome. The first 2 AIDS cases in Nigeria was diagnosed in 1985 and reported in 1986 in Lagos State, one of which was a young female sex worker, aged 13 years, from one of the West African countries. Infection rates of HIV are not slowing fast enough to reach the goal of eradicating AIDS by 2030, according to a report by the United Nations Group to Fight the Disease. The report by the Joint United Nations Programme on HIV and AIDS said shortcomings in the pandemic response can also be seen in the fight against the decades-old disease. In June 2021, UNAIDS set new targets to reach by 2025, bringing HIV services to 95% of those who need them, reducing annual HIV infections to fewer than 370,000, and reducing AIDS-related deaths to fewer than 250,000 by 2025, although the report said the world is off track to meet those goals. It further highlighted 5 urgent global AIDS strategy priorities it said should be funded and implemented globally for pandemic prevention, preparedness, and response. World AIDS Day, designated every 1st December since 1988, is an international day that has been set aside to create awareness on the disease, acquired immune deficiency syndrome, which is caused by the spread of infection of the human immune virus. We're on the streets of Abuja to talk to some Nigerians about their perception of the disease.
Prior to now, if you just hear AIDS, it just means a death sentence. But with time, we've come to realize that there is a hope for people suffering from AIDS. So AIDS is now something that can be managed, and this only comes if you are able to get the required information you need and then go to the proper places where you're supposed to get the needed treatment and care. Then it can be managed. People living with HIV and AIDS now can have hope of a better life due to the advanced technology in medicine that has given them the privilege to have access to the retroviral drugs that helps them boost their system and then live a normal life like other normal people.
AIDS is something that makes people to be very, very afraid, because we know that AIDS, before we have AIDS, there should be HIV. So HIV is just a virus. Though it can be controlled, but it has no cure. And I believe anyone that is being affected with that should have drugs that can control him or her so that he can live longer. But if you don't take your drugs, I believe that is when it will now grow to AIDS. And at the process of AIDS, you cannot have any other, as in like drugs to control that. And at that stage, I believe such a person will, the person will in the point of death. So that is it. That is why people are afraid of it.
AIDS, before now, was, in fact, when you hear about AIDS, it's like a death sentence. People were scared of it, and when people when they contract AIDS, it's as if your end has come. But with the awareness of NACA, FACA, and all that now, people are now beginning to know that even if you contract AIDS, it's not a death sentence. That you can have AIDS and live for a long time, depending on the way somebody is being taken care of, like by provision of their treatments, and also good living by eating good foods and living a good life.
There have been a lot of education about AIDS since a long time, and ever since then I've been well educated. Whenever I hear HIV, what comes to my mind is a sickness that can be cured. It's a sickness that you can stay with and manage it till when you finally get your real healing. So it's not a death sentence. It's a sickness that you can manage it. If you handle it properly, you will live longer, more than people who are not even sick.
We are really making progress in ending AIDS. So what we are doing is simply doing what they call epidemic control, which is trying to make sure that we ensure that a lot of persons who know their status are on treatment, and also ensure that they are virally suppressed so that they are not able to transmit the virus. I guess one of the major challenges is the fact that we really don't have so much of the machines used for viral suppression across the country. And so one big problem that he has is that you have a lot of samples waiting, for them to get to the lab. And so that time lag is a bit of a challenge, and you don't have it all over, the states. I can remember, in some states you have to go to another state to ensure that people have, their samples tested. But I guess we're overcoming it gradually, and I'm sure with the structures put in place by the government of Nigeria, that will be a thing, in the past. We can say that with all sense of responsibility, given the fact that the current government has actually taken it upon itself to ensure that people living with HIV and AIDS have access to ARVs, which is quite key, and also ensure that they are not stigmatized against. They have access to their drugs, and they are protected by our laws. And given the fact that the current DG of NACA and the NATSCAP coordinator have actually tried to see how they can work in sync with the network of people living with HIV and AIDS. My simple message to Nigerians is go know your status, which is quite key because it's the beginning. And so whichever way the pendulum swings, if you're positive, there are drugs, life-saving drugs for you, and we have a lot of support to ensure that you have access to those medicines and you live a normal life. And if you're negative, it means you need to keep practicing those behaviors that will make you stay negative. And so we also want to encourage people that, you know, it's no longer a death sentence. There's always a way out, whichever way the pendulum swings.
The last 3 years of the last 20 years of HIV response in Nigeria has been a turning point. We've seen growth in the number of people that are living with HIV/AIDS. We have on our register receiving treatment and also continue to receive treatment, have their virus suppressed. And you know, once that virus is suppressed, if we don't see it, it doesn't get transmitted to other people. The number of new HIV infections that have been detected among newborn, we have an estimated number of about 21,000 annually that happens based on our estimation. But in terms of the number that died from HIV, is not 13 out of the 22 that are newly identified. But you're talking of 13,000 out of about 150,000 children that are living with HIV/AIDS in Nigeria. What we are looking at going forward is to expand access to mother-to-child transmission of HIV. And the way we plan to do it is to have people realize that the newborn or the unborn baby has right to be protected from HIV. And this starts with not only with the mother, but the parents in general. Mother and father should know that the unborn baby under their custody has right to be protected from HIV. And if that creation has right to be protected from HIV, the mother must, as a matter of responsibility, ensure she has access to HIV testing services during that pregnancy. We are working with National Human Rights Commission. When we get cases of human rights violation, stigmatization and discrimination, there is a legal unit that look at the cases and refer to the relevant unit at the National Human Rights Commission to take up the case, support the individual involved, and making sure that justice is served. There are devices for prevention newly launched, and now they are tested across the globe. There are devices for testing, and there are new treatment modalities. They are all out there. Prominent among is the HIV self-testing. These are devices that provide individual opportunity to test themselves, to know their HIV status at the comfort of their rooms. Sit down in your room, use your body fluid, saliva in particular, test yourself to know whether you have HIV. Within 20 minutes, 15 to 20 minutes, the result is out. You can read it, and you can also interpret it given the guide that is provided that come with the test.